So first of all, is that how you pronounce your name, Dr. Demsas, or how do you want to be called throughout this?
You can call me Falen.
Okay, perfect. Yeah. So hi guys, my name is Amber Park, and I'm a OMS, and I am now part of the AWS IG, and this is.
Sorry, you're kind of cutting in and out. Hi everyone, I'm Sarah. I'm a fourth-year medical student at Michigan State University College of Osteopathic Medicine, and I'm also part of the AWS Instagram subcommittee.
And hi everyone, my name is Sophia Chavarria, as you guys know me. Now I'm actually co-chair of the Communications Instagram Subcommittee of Association of Women Surgeons. I'm glad to be here.
Awesome. So now we have Dr. Demsas with us, and she's a current PGY-2 at Massachusetts General Hospital, and if she'd like to introduce herself as well.
Sure. Hi, everyone. My name is Falen. You guys are welcome to call me Falen. I am a PGY-2 at Mass General, just starting my second year of residency, which is really exciting.
Okay. Thank you. So I guess to just get us kicked off, could you tell us a little bit about where you went for undergrad, where you went to medical school, that sort of thing, just your journey prior to pursuing residency?
Yeah, absolutely. So I think I had a very different journey than most people that come to medical school. So I graduated from Boston College in undergrad. I mastered in biology. I had a minor in faith, peace, and justice. I knew I wanted to go to medical school, but at the time I kind of just wanted to have a little bit more real life experience. So I decided to take some years. So my first year out of medical school, this opportunity to become a high school science teacher popped up. So I took it. And if you know anything about like teaching high school, once you start with ninth graders, you want to see them graduate. So then 1 year becomes 4 years. So I stayed there for a couple more years, and kind of really, I enjoyed the experience I was getting and a lot of what I was learning. I taught in California, in Compton. It was a very under-resourced, underserved charter school that I was working at. And there was just a lot of unique experiences, I think, that I gained from that I wouldn't have been able to get outside of that sphere. So after that, I then kind of put my eyes back on going to medical school. So I worked for a community health like nonprofit in Washington, D.C. for a few years as I was, and then applied to do a master's program at Loyola, actually. And the goal of that was just sort of to get my mind thinking a little bit more academically, a little bit more scientifically, because I had taken some years out. I wanted to make sure that I was prepared for the rigor of going to medical school. That was actually out of the recommendation of one of my mentors, Dean Nakai, who told me you probably want to do something to really kind of strengthen your preparation for medical school. And I'm really glad I did. So after that program at Loyola University in Chicago, I went to Dartmouth for medical school. So that was sort of my, circuitous journey.
Yeah, I think that's so crazy how you went out and then came back in. I think that's really hard. So a lot of kudos to you for that. But particularly why vascular surgery?
Yeah, that's the many times, when I was on the residency interview trail. So I think the one thing that when you're in medical school, you first make the decision about whether you want to go down a more medicine path or more of a procedural path. I think that's like one of the first determining. I don't know if you all are there yet, but it may be one of the first decisions that you make. And I think both are excellent. I enjoyed all of my third year rotations, but I think they just demand different personalities, and you have to know enough about yourself to decide. So I'm very solution oriented. If you were to ask my family or my friends, I'm very solution oriented. Something has to be done hands-on person. So I kind of already was a little bit biased towards a procedural field. And during my first year of medical school, I met one of my mentors at an AWS dinner. Interestingly enough, I'm not just saying that. No one has paid me to say that. And Dr. Stableford at Dartmouth. And she just invited me to the operating. I didn't know what vascular surgery was at the time. I was like, oh, this is, everyone kind of knows about plastic surgery or orthopedic surgery or neurosurgery, kind of cardiac surgery. These are kind of the more forward fields, but vascular surgery is an incredibly prominent and important field, but it's a little more humble in the background. And she invited me to the operating room. And then after I did a case with her, she told me to go do a case with one of her colleagues. And then that day I was in 3 different operating rooms, operating on 3 different parts of the body. And I just thought that was so cool. So it's not unique to any one area, right? We do carotid surgeries in the neck, abdominal surgeries, open aorta surgeries, as well as peripheral surgeries in the extremities and the legs, right? So it was very unique. The acuity of the procedures was also so variable. So a carotid endarterectomy, carries with it a certain type of unique detail and precision, and so does abdominal aortic work. And then you can do venous procedures, which are a little less high risk, I would say, but still pretty fascinating and important work for patients. So to me, I think that was one thing that gravitated me towards the field. The other thing is, there's surgical fields where you can operate and you see the patient do great, and that's the last time you really see the patient. In vascular surgery, you do a lot of follow-up, and I actually really like that. That was like the medicine heart in me. I appreciate the fact that you see the patient in the operating room and they continue to see them over time. So you see how they're doing, not just how they're doing from your operation, but how they're doing with all the other aspects of their lives. And I think if you care about continuity of care, you care about that longevity of relationship with your patients, it's certainly a field to consider very strongly. Last thing I would say is, like, if you're interested in research, right, there's such a breadth of research, within vascular surgery. I'll kind of just leave that briefly, but there's a lot of innovation, there's a lot of interrogation of how we do things and how we can do it better, and I appreciate that. The willingness to improve, I think, is an important thing about a field.
That's true. Yeah. And Dr. Falen, I also have a question. Well, I found out also that you were a former co-president for AWS. And so how does it feel to be on the other side? And also,
Oh, no, go ahead.
Oh, and also, like, what are some things you did in medical school that was, like, prepared you for your application for vascular surgery?
Excellent question. Thank you so much. So at the time that I was president of AWS, Maggie Leach, who's now a general surgery resident here at MGH with me, and Jen Wiley, who's down south at Vanderbilt, and Caroline, who actually decided to go into anesthesia. So, AWS kind of accepts everyone until you make the decision that's best for you. We were all the leadership of AWS. And what we did, a lot of the work that we did, we collaborated with the folks that were down at Harvard and did a session there. But a lot of the work that we did when we were at Dartmouth was just introducing folks to different fields in vascular surgery, and also mentorship. I think that's such a huge part, is people who can support you, and mentorship looks different at different levels, right? It's people who maybe are writing your letters of recommendation and giving you kind of structural sort of career advice, and then there's people who just give you support and let you know that you can do it, and as difficult and challenging as it is, that there's many roads to success, and so you just kind of have to be patient and willing, and really kind of have that resilience, and then there's even maybe it's not, mentorship is not the right word, but there's like lateral colleagues, like people who are just like with you in the trenches and kind of going through with it. And there's sort of, a mentorship of sorts in that as well. But I think that's what AWS gave us, is all 3 of those things, that ability to have support, as much as I think we are seeing the transition of an increase in women or people who identify as female within the field of surgery. That's not necessarily mean that we are, we're still underrepresented in leadership positions. We're still underrepresented when it comes to chairs and chiefs and, leadership positions within the field. And I think it's an important transition for us to make in that space. And so I still think we need more people like us in the field. When it comes to, so your second part of your question, I just lost.
Well, I think I'll repeat my question, but I think that's amazing. You're a really awesome role model for every woman, especially who wants to go into surgery. And I think we should all follow your path, or even guide through that. And hopefully we all went behind the camera on the other side, just like you.
So you'll get there.
I think
Yeah.
I think it is so cool that AWS was actually part of your journey because we didn't know that before. Like we sort of just randomly reached out to you, like, oh, here's an awesome woman in vascular surgery. But that's so amazing that we actually like this organization has played a role for you in your mentorship experiences. So I think for our next question,
I was gonna go
ahead,
back to
Sophia.
the things that you did in medical school to prepare for your application to go into the residency.
Yeah. I think this is an important question. You know, when it comes to people that are like women in vascular surgery, you know, I think you can certainly speak to a lot of people within the field. I wanted to really do this because I think having been just out of the application process, I think there's hopefully a lot of my experience I can offer is what can help folks in this part. One thing for me is I think the application for residency is changing a lot with step 1 being pass fail, and then having a more, you know, step 2 is now scored, so people feel pressure to do much better on step 2. And, you know, then it leaves this question of like, what do I do? And it's a conversation I've had with friends of mine who have just graduated from medical school, as well as other people that I've kind of helped, you know, lend advice or mentor over the years. So I think the most important thing about your application preparation for medical school is everything needs to be authentic. Like, I think people can tell when we're pursuing experiences and opportunities, and it's good to be a person who says yes and kind of welcomes those opportunities, but you want to show that you're authentically invested and committed to things that you're passionate about. So if you're not really, you know, if you're really passionate about, let's say, you know, machine learning, artificial intelligence, like more kind of that aspect, then do that and do it well. But if it's just this thing that's like really popular and everyone loves to do now, but it's not really something that drives you, then I would say, like, you know, stay away from those things, and find the things that actually drive you. I think, you know, if you're interested in equity, do that research. If you're interested in, you know, bench lab research, do that research. But in any sphere, I think research should be a component, but doesn't need to be an end-all be-all of your application for medical school. I'm giving you that advice. I didn't necessarily take that advice because I think I said yes to a lot of opportunities, and I was like, okay, this doesn't, you know, really like align with what I'm trying to do. But of course, once you commit to something, you want to complete it and do it well. But then think about the next time you commit to something that, okay, that was not maybe something that I should have done. Another piece of it, I think, that's important is take advantage of whatever is your like sort of life skill or your niche. A lot of what I was involved in when I was in medical school was around leadership. So I served in student government while I was at Dartmouth, and I was president of the student body. But even before that, I got involved in just more minor roles where I was representing my class, and then, you know, representing like vice president of professional development, doing different things like that within spheres. You know, you guys are all members of Association of Women Surgeons. So doing things like that, I think that demonstrate that you have maturity, leadership capabilities, ability to work on a team, which is so important when you're in residency, because that's essentially what it is. It's like a long-term team kind of dynamic that you have to be able to navigate and really work well in. So I think those are all important aspects of your application to medical school. Of course, the tests matter. I know there's like mixed opinions about whether step 1 going pass fail is a good or a bad thing, but I think it's not the end of the world. There'll be so many standardized tests that people can judge you on that I don't think like that needs to be, you know, the metric that decides who goes into and who does not go into residency. I think it has helped to find different sorts of folks to go into different sorts of fields and not kind of making it just about this score, this you know, specialty, which I think is really important. So I think those are some of the things that I did. I don't know how succinct that was, but hopefully that was helpful, or I'm helpful to clarify if anything was unclear.
Interesting. Great advice. Thank you.
Sure.
Thank you for sharing that. And I think that for our next question, you did already kind of touch on this, but we were wondering if you could describe your typical range of surgery.